screen?
Yes. Yes.
Okay. Is my audio okay now?
Yes, very good.
Okay, thank you. Thank you, Kavita, for showing the trap tubes uh, advantages. But I'll just share. So this is just a disclaimer. The image of the opponent and the RO lab are just dramatized only for the debate purposes and not for any other personal grounds. So this is my beautiful opponent with all the jewelries, and I don't think any other space is left over for her to use any more jewelry, but still she managed to have one more from the RO lab. There's a BAS marked one, you can see from the earrings. So this is the new device which she was just talking about. So what do you really expect when you do the glaucoma surgery? One is the intraocular pressure control. Then of course the long-term outcomes is very essential to understand how it really works. And the ease of doing surgery is extremely important. The learning curve is again important. Just looking at the other things, she was just talking about the US economy, but what we need is the Indian economy, how it is really. So, and then looking at the repeatability of the procedure is extremely important. Looking at the number of publications, there are infinite number of publications from the TRAP group. And then of course, once you see the tube group, only there are 2 publications comparing the primary tube versus the primary TRAP. And I think all of us know that how many of us really do as a primary tubes in our surgeries. So as Kavita was mentioning about, I'm also going to talk about the same primary tube versus trap surgery at the end of 1 year and 3 years. And there is another one more study in the Acta Ophthalmologica, which is comparing the Babel with the trap, that is at the end of 5 years. This is in fact a refractory glaucoma study. So just look at the IOP drop, though she was mentioning about the comparisons. At the end of 1 month, of course, we don't expect much of a difference in the IOP drop in the tube group, but the trap is obviously is much better at the end of 1 month. And of course, you see at 6 months again, there's a significant difference of about close to 2 millimeters. And also at the end of 1 year, there is another around 1.5 to 2 millimeters close to that. And at the end of 3 years, again, you can see close to 2 millimeters of difference. We all know that every millimeter matters a lot, especially when you have advanced glaucomas. Every millimeter makes a change of 10% risk reduction. Just looking at the PTVT study at the end of 3 years, there is a change, at least about close to 2 millimeters difference. That is very important for us to understand. This is the other study which I showed as the Acta Ophthalmologica at the end of 5 years. We can see that the intraocular pressure control is almost same in both the groups, in fact, the survival rate as well. But just look at this data, how many AGMs the patient really requires at the end of the 5 years. There's a significant difference in the requirement of AGM in the Babel group. There's about close to 1.5 to 2 medications is the additional requirement which we really need to put the patient on. Looking at the postoperative interventions, there is no significant difference between the 2 groups, the tube versus trap study. But as Kavita was mentioning about the serious complications, I'm not sure what kind of a surgeons was involved in the other group. How many of us have really had seen that so much of complication in our own context? I don't think we have so much of complications, but in fact, we have seen more complications with the tube in reality. Though this is a very well matched study in US group, but in Indian scenario, I don't think we have so much complications in trap in comparison to the tube. So just look at the ease of doing surgery and the learning curve. It takes about 15 minutes to do the 15 to 20 minutes to do the trap surgery versus 60 minutes, close to 1 hour. If you have 5 cases in a day, you are almost dead. You cannot go to the OP and see any more patients in your OPD. So the whole day is over for you with 3 or 4 cases. And even in experienced hands, there is a very, very steep learning curve when you want to do the tube surgeries. Looking at the economics for the patient, probably for Kavita is fine. She can have more jewelries in her. But looking at the patient's perspective, at least 2 to 3 times the more cost per surgery. And if you want to really repeat the procedure, I don't think you can do 2 or 3 in a tube surgeries. Of course, in traps, at least you can do minimum of 2 repeat procedures. I don't think this is really a judgment day. It has already been decided. There is no need to go and do such a complicated procedure as a primary procedure. And I'm sure the Kavita will change to much more simpler, much more beautifully prepared than having all the jewelries. Simple surgery, simple, very useful outcomes. There's not much of a complications. I think I would look at going in for the primary trap than for the tubes. Thank you so much.